Good morning. Today I'd like to discuss why I believe the current NHS Bill going through the Houses of Parliament is one of the grossest violations of our democracy in perhaps as much as a century. I believe this for three key reasons, the first of which is the activities and words of the Tory party prior to the general election in May 2010. David Cameron said that you could sum them up in three words, those were NHS, that he would not have any top-down reorganisation and in fact that he would ring-fence it. And to back that up, his manifesto on page 45 that deals with healthcare did not mention the word private once. If we consider that on average the private sector accounts for 2% of the bed utilisation and theatre capacity in our NHS hospitals, and that the current bill proposes to increase that to 49%, I think to exclude this from their words, speeches and manifestos prior to the election is tantamount to duplicity. Now, the British people recorded their verdict on the Tory party at the general election. They did not give them a majority. They had just 36% of the vote, and they required the Liberal Democrats to form a majority. And that party also omitted these NHS plans from their manifesto. And if you actually read the coalition agreement, it's not particularly detailed in it. Andrew Lansley has made up these reforms in a hodgepodge fashion as he's gone along. There is no mandate for them. And I suppose that's the main reason why the healthcare professionals and the British people have by and large rejected them. Almost every major healthcare union and professional body has democratically balloted their members, and they're overwhelmingly opposed to this bill. A YouGov poll showed that 66% of healthcare professionals believe that this bill will make their service worse. Not only that, only 14% of the UK voting public want this bill to succeed. There is no appetite, there is no mandate, there is no legitimacy for this act, and that is why I am firmly of the opinion that it is not democratic. Now, unfortunately, in our efforts to curtail the excesses of this government, we have been denied the opportunity for debate, modification, and a thorough examination of the risks attached to this bill at every possible hurdle. The House of Lords has been whipped, and it's been prevented really from giving the bill proper scrutiny. Not only that, you and I have signed an NHS petition, more than 170,000 of us did, calling for this to be debated in the House of Commons, and that was rejected, despite Cameron in February 2010 promising that whether he liked it or not, any petition that acquired 100,000 votes would be automatically given debate in the House of Commons. In addition, the Information Commissioner has ordered for the NHS risk register to be published so that we can all examine the dangers of this bill and perhaps debate them and take it into consideration before the bill becomes law. But again, the Tory government have prevented this from becoming public so that we cannot have the debate we need. And in addition to all of this, we now have stage managed visits by our Prime Minister and our Health Secretary into hospitals where they're not allowed to meet proper patients, where staff critical of their bill are held back from interaction with them, and where glossy photos are released afterwards pretending that the visit passed off peacefully. And this is the shambles into which this bill has descended. There is no appetite out there for this, not even, I suspect, in the hearts of the Tory party. And history will record its verdict that this is probably the grossest violation of our democracy, certainly in my lifetime, and I think since the House of Lords Act in 1911. Not since the Corn Laws and the suspension of habeas corpus in 1815 to 1819 have we had such a violation of the wishes of the people. Thank you very much.